Hello and welcome to the Center for Medical Justice, where we've been keeping you up to date on the U.S. government's war against patients suffering from chronic pain or addiction, and the doctors who try to help them. As physicians all over America have been targeted and attacked, with false metrics, compromised witnesses, and misleading expert testimony, the effect on the practice of medicine in the United States has been profound. Every doctor targeted and shut down or imprisoned leaves up to 1,000 patients abandoned without care. And since the DEA targets any doctor who takes them in, everyone is too terrified now to help. If that wasn't bad enough, now that most primary care doctors and even specialists are too scared to treat pain, doctors treating addiction are also being shut down and thrown in prison. One is on trial right now in the state of Maine. And even those treating ADD are starting to be targeted. The use of any controlled medication in America for any purpose is being declared an illegitimate practice of medicine by the DEA. There is not a single doctor treating a single patient with a single dose of controlled medication that could not be imprisoned using the government's new false metrics. Some may point out that federal law prohibits any employee or agent of the federal government from trying to even influence the practice of medicine in America. But there is no one to enforce this law except those who are breaking it. And their terroristic tactics have done much more than influence. The DEA is, in fact, now dictating the practice of medicine in this country. And it is no longer safe to be a healthcare provider here. The DEA's biased AI algorithms have particularly targeted physicians of color, especially if their practice is in a largely minority area. One case of clear overreach by the DEA involves Dr. Rahindra Batra, a physician who had worked with Mother Teresa herself, helping to build a new hospital in his native India. But this wasn't good enough for the government. The DEA told jurors that Dr. Batra was a greedy pill pusher who ran his clinic like a McDonald's drive-thru, when in fact, he was a dedicated and legitimate pain specialist, helping mostly elderly pain patients have some quality of life. Along with Dr. Batra, the DEA indicted 5 other dedicated physicians, at least 3 of whom I can identify were physicians of color. The odds of this bias being by chance alone are practically nil. These doctors were shut down, and they were accused of committing $500 million worth of fraud, with the usual false metric of 13 million dosage units of opioids being used to excuse charging them with drug crimes. These men could have received life in prison. The U.S. attorney in their case said that healthcare professionals who prey on patients who are addicted to opioids in order to line their pockets is extremely egregious. We will continue to prosecute such individuals who choose to violate federal law and their ethical oaths. All these claims turned out to be lies. And while these doctors were lucky enough to be acquitted, most are not. Bankrupted into hopelessness and left without the resources to defend themselves, they often take a plea deal, just hoping to see their families again. Some, even after acquittal, find that the destruction of everything they worked so hard to build is just too much for them. Other doctors see this happening to their colleagues and decide it just isn't worth it, going into other fields of medicine or leaving the practice of medicine entirely. Some large pain clinics cannot find enough physicians willing to treat pain to keep the doors open. In Grand Rapids, Michigan, a pain management practice with 3 locations announced that it was closing its doors, blaming a difficult climate facing independent pain management practices. Others are closing too, leaving an estimated 50,000 pain patients scrambling to find care in this region alone. And our country, caught in the depths of an opioid panic, has turned its back on all of them. Right now, today, there are no effective alternatives to opioids for severe chronic pain. And patients every day are choosing suicide over agony. This is a choice they should never have to make, and they wouldn't if physicians were still allowed to practice according to their education, training, and experience, and not the evidence-free mandates of federal agents practicing medicine without a license. But what happens when the government's case does fall apart? Are these agents held accountable for violating their oath to the Constitution, and the federal attorneys for violating their oath to truth and justice? Not at all. Because they accomplished their goal of terrorizing the American medical community into practicing medicine as the federal government dictates. And the acquitted doctors whose reputations and clinics were destroyed get nothing, not even an apology, quite often still not being able to practice, because while the DEA might lose in court, it will still pressure medical boards to take your license and refuse to return your property. These are very dark times to be a patient with pain and addiction in America, and for the dedicated doctors who are just trying to help.